Welcome again to my channel. I hope your day is fun. So we are talking now about meningeal irritation signs. Now the question is, what is it? Let's check it out. Meningeal irritation signs are most often found when there is irritation, inflammations, and bleeding in the meningeal membranes. The principle of the examination is to put pressure on the meninges and nerves that are irritated. The pressure provides compensations in the form of posture movements and muscle contraction. So this is the anatomy of meningeal. Specifically is meningeal and superficial cerebral vein. Now look at it, there's arachnoid granulations and there's arachnoid durometer and suprarenal space and also perimeter. There's three components of meningeal. There's a supracerebral vein, calvaria, and also gale aponeurotic. So how the examinations? We can know the signs from 4 signs as nuclear rigidity, Kearney signs, Leipzig signs, and Brzezinski 1, 2, 3, and 4 signs to know the irritations of meningeal. Now we are talking about the first signs. It's a nuclear rigidity. The first is the examiner's hand is placed under the head of the patient who is laying down, and the head is placed and the chin is trying to reach the chest. Caution: the nuclear rigidity signs positive. It was found that the chin could not reach the chest because the patient was trying to hold it. And the second is Kearney signs. Flex the patient at the hip joint to make a 90 degrees angle, and lower air is tended to an angle of 135 degrees. Cautions: the Kearney sign positive if there is a resistance before reaching a 135 degrees angle. And again, the Leipzig signs. The patient is asked to lie straight and one leg rest straight at the hip joints. And normal, this reaches an angle of 70 degrees. Cautions: Leipzig signs is positive if there is resistance before reaching 70 degrees angle. And now, we are going to know about Brzezinski. Brzezinski signs. The first Brzezinski signs as the examiner's hand is placed under the head of the patient, and for this man or the doctor, bend the patient's head as far as you can until the patient chin rests. Cautions: Brzezinski is positive if there is a flexion of both legs. And now we're talking about the Brzezinski signs. That's the second Brzezinski signs. First is one leg is flexed at the hip joints while the other leg in a straight line. Cautions: the Brzezinski sign is positive if the other leg is also flexed. Now the third Brzezinski signs. Now we have a zygomatic bone in our face. Then the examiner says press the zygomatic bones. Caution: the Brzezinski sign is positive if there will be a flexion both arms when the patient's zygomatic bones is pressed. And the last is Brzezinski 4. Thus, we know about the sympathic pelvis. Now, when the examiner pressing the patient's sympathic pelvis, cautions: the Brzezinski 4 signs is positive, whereas there's be a flexions in both legs. Okay, until here, thank you for your attention. Please support my channel. Thank you.